Barbara, this is John Hager. Susan Gaudette.
John, this is Tom. I'm on the line. We have 3 board members on the line so far. Let's get the names down.
Okay. It's Larry Hurst with Anthem, Blue Cross and Blue Shield.
Thank you. Sarah Bradley, Deputy Attorney General. Thank you, Sarah. Who's joining the line?
Linda S. Jackson.
Lewis. Thank you, Levon.
This is Dennis Goldford.
Who's joining? Who's joining the line? Dr. Klein, have you joined the line yet? John, did you talk with Dr. Klein today to make sure that he's still available?
I didn't talk with him today. He indicated he was going to be here, and I sent several reminders out to the board. I can send him another email and.
Maybe that's him. Dr. Klein?
Yeah, Dr. Klein. I just logged in.
Oh, thank you. Okay. Well, it is 4 o'clock, and we have a forum set for the Silver State Health Insurance Exchange telephonic meeting that's noticed for today at 4 p.m. First thing I'm going to do is call the meeting to order. I'm going to have John conduct the roll call for us, and then we will have a few announcements before we get started with public comment.
For the record, this is John Hager. Ms. Atkins, I believe, indicated that she would not be able to attend. Dr. Klein? Yeah, I'm here. Dr. Ford, I believe she indicated she would not attend. Ms. Lewis?
I'm here.
Ms. Kerr?
Yes.
Director Mollenkamp? Here. I believe Director Johnson indicated he could not attend. Director Wilden indicated he could not attend. Vice Chair Johnstone?
Here.
Chair Campbell?
I'm here.
And Madam Chair, would you like me to make a few announcements before we start?
If you would, please.
First of all, if everybody could please mute your phones and wait until you're called upon by the chair to talk, it'll make this discussion a lot better. Also, please do not put us on hold. You'll end up will likely put us into a music that we think turn off. Please understand that the sole purpose of this meeting today is to discuss and ratify the BOSS and ID&D contract, the Business Operations Solution, and the Independent Verification and Validation vendor for the BOSS contract. Specific policies of the board will be discussed at later meetings. of which the next one will be in August. Due to summer vacation schedules, the next board meeting scheduled for August 9th has been canceled. We will let the board and the public know when we have a time and location for the August board meeting. So as I indicated, we'll be discussing the Boston IB&D contract, and the intent of this meeting was not to discuss any other policies, nor is it the purview of the board to make any policy decisions regarding Medicaid expansion that is not a function of this board. With that, I'd like to turn it over to the chair.
Okay, thank you, Mr. Hager. I'm going to open it up for public comment. Because we're on a telephone conference, it makes it a little bit harder to record that public comment. I'm going to limit comments to 3 minutes. And then I would ask if you would like to participate in public comment, that you state your name and spell your first and last name for the record so that we properly document that for our meeting minutes. So with that, I'm going to open up the beginning of the meeting with public comment. So anyone that would like to participate in this, give us your name and spell it for the record. Okay, doesn't sound like we have any at this point. The agenda, first item on the agenda for possible action is the discussion and possible action regarding the ratification of the Business Operations Services, which is commonly known as BOSC, vendor selection, and this was an RFP number 2023. John, I know that we have posted on the internet the background materials that the board has, and I think that you're going to give us, or you're going to have some background on this RFP.
That's correct. Before I turn it over to Shauna, I would like to remind the board that on January 12th of this year, we discussed the RFP process for the Boston IB&D vendors. The board unanimously approved the proposal from staff to give the authority to the executive director to go through the verification and make the selection of the vendor. So as we went through the process, and a lot of that was because of the tight timeline for implementation, as we went through the process, we tried as best we could to keep the board updated on the process. At this point, we are seeking that the ratification of the contract by the board so that it can go to the Board of Examiners. Assuming that the board approves the BOSC contract today, it can be ready for the Board of Examiners as early as next week or as late as August 14th. I'm not sure if the agenda for if there, I don't want to say that there's a special DOE until we know for sure that there is one. So with that, I'd like to turn it over to Shauna DeRuth, our operations officer, to discuss about some of the specifics of the contract. Shauna?
All right, thank you, John. As Barbara said, the information regarding the BOSC vendor selection and the RFP process was posted online. I will go over it briefly, but not read this document as it is there for you to read should you so desire. The last 5-6 months has been full of RFPs, as John said, the IB&D and the BOSC. The BOSC started in March 26, 2012, and purchasing, the Division of Purchasing, posted the request for proposal number 2023 on their website. That RFP was posted for several weeks. There was a question and answer period, and it followed the Purchasing Division procedure as stated in NRS 333, and NAC 333, excuse me. The BOSC RFP sought to acquire a vendor to provide a service as a software to come in and provide a web portal, premium aggregator, stock exchange, eligibility processing, those functions that will engage the public and do the exchange. The RFP provided information to the vendors so that they could respond, and they were to present their information that would support the business functions of the individual and the topic teams. It was to develop and implement required interfaces, and the proposals talked about how they would do that. It would be to implement the fully tested exchange by that October 1st, 2015 deadline when the open enrollment starts. The RFP talked about establishing a call center. It talked about providing training. It talked about operating for 3 years with an option for 3 additional years. And it spoke to working collaboratively with the exchange and all of the state agencies that work so closely together to provide this service to the public. So we received 4 responses to the RFP, and as the vendors put together their RFPs, they understood that the RFPs would be scored on things such as conformance with the terms of the RFP, their expertise of their personnel, the references that they provided, the cost, and then we had indicated that we would have presentations and demonstrations of the solution that they were proposing. On May 8th, as I said, we had 4 proposals, and there were 5 evaluation committee members. The evaluation committee members there were 2 from the exchange. There was a member from the Division of Insurance, from Welfare and Supportive Services, and from the Nevada Enterprise Information Services Division. So we had a very good cross-section of evaluation members. We met on May 15th to consider the proposal. The evaluation committee selected 2 vendors to provide a presentation of their proposed solution, and we saw those proposals and presentations on May 29th. We evaluated the scores on May 29th, and we selected the highest scoring vendor at that time, and negotiations began on May 30th and were finalized on June 1st. Some of the reasons given by the individual evaluators for the scores, and the evaluators, they chose Xerox Healthcare Solutions as their solution. And we chose them because that 90% of the requirements that were being requested in the RFP were met in their solution just as it was presented. Only 10% of the solution will have to be modified to meet the needs of the exchange. They had excellent subcontractors and partners. They were experienced in running similar projects successfully. Their web portal layout was user-friendly. The management team exhibited skill and reasonableness and poise. They will establish the call center in Nevada. The plan is to establish that call center in Las Vegas. The presentation clearly illustrated the functionality across Medicaid and SSHIX as well as the exchange. And there were minimal contract exceptions, which was the reason that we were able to do the contract negotiations in just 2 days. The effective date of this particular contract will be from the Board of Examiners' approval. It will run through December 31st of 2016, and there are 3 possible 1-year periods of extension in accordance with the RFP terms and conditions. The contract amount is not to exceed $71,963,229, and this is based on design, development, and implementation costs of just under $20 million, with an additional $257,000 available for potential change orders, and then a per member per month cost of $7.32, $6.72, and $6.20 for calendar years 2014, 15, and 16 respectively. If the exchange has not yet decided to do the premium billing, once that is decided, there may be issues to those per member per month costs as indicated in the report. So that concludes my report, and the recommendation from staff is to let the board evaluate the recommendation that the exchange contract with Xerox Healthcare to provide the business operations solution. I'd be happy to answer any questions.
Thank you, Donna. I'm going to open it up to questions from board members. If you could just identify yourself for the record and for ease of participants, that would be helpful. Thank you.
Madam Chairman, this is Lavon Lewis, and I just had a question. One, is this a Nevada firm?
Xerox is not based in Nevada. They are registered in Nevada as a, John, what's the word I'm looking for? It's not a...
They're registered in Nevada with the Secretary of State.
They are, but not as a Nevada firm. It's a foreign corporation. That's what I'm looking for. Foreign corporation.
Did we have any Nevada firm bid for this contract?
One of the proposals had a Nevada firm as a partner, not as the main proposal vendor that was submitted. They did have a partner that was based out of Nevada.
Thank you.
Dr. Klein, you mentioned in some of the written material that they have experience in implementing similar types of programs. Since there is no exchange anywhere else, can you detail on what it is that they have experience in doing?
I can. So one of the partners that Xerox teamed up with to form this proposal for us is Choice Administrators. And Choice Administrators has been successfully running the Cal Choice exchange in California for the past, John, correct me if I'm wrong, I think it's 15 years?
Yes, about 15 years.
So they have successfully demonstrated that their product is successful and does work.
Okay. And have you spoken to people in California and they agree that the product that was successfully implemented?
Dr. Klein, I personally have not done so. We got recommendation letters.
Okay.
And as part of the RFP process, we received referrals from several people, and their referrals were very good.
Okay. Thank you.
Any other board questions?
Madam Chair, this is Leslie Johnstone.
Sure.
I don't know much about the Medicaid expansion issue, but is the Department of Health and Human Services moving forward with their eligibility system changes, because weren't we dependent on using their system as the entry point into the box? And is that changed in any way, and how dependent are we on the ultimate decision about the Medicaid expansion?
So, Ms. Johnson, this is one of the eligibility engine vendor was Deloitte Consulting, and they are currently working with welfare to design and build the new eligibility engine for Medicaid. Whether or not that decision is for the Medicaid expansion, that eligibility engine will be built, and it will determine eligibility for the premium tax credit, for Medicaid, for SSHIX eligibility, and these two systems will work together to do so. It is not dependent upon the Medicaid expansion decision.
Okay, thank you.
Mm-hmm.
Do we have any other questions?
So this is Dr. Klein. So we have software programs from now 2 or 3 different vendors that we all depend on working together. So we have our software vendor if we decide to go with Xerox. We have Deloitte Touche creating a software eligibility engine, and this has to interact with Medicaid software, which is run by Hewlett-Packard EDS. So is that correct? We have 3 different software programs we all need to play nicely together?
The nice thing is that the eligibility engine will be built per the specifications of the state to work directly with the exchange and be able to interface with the Medicaid system, with the MMIS system. So although the MMIS system is already established, and although the exchange system is basically coming out of the box and will just be modified for us, that eligibility system will be built specifically to interface with those other 2 systems. So we do have a little bit of comfort that they'll build it to make it work.
Madam Chair, if I might, this is John Hager for the record. And yes, there are multiple vendors working on this project. We have a fairly robust quality control project or implementation team. The members of the team that are working on the IT side of it from the state side are very experienced in project implementation and communication. In addition to that, the federal government requires for these contracts that we include an IV&V vendor, an independent verification and validation, or independent validation verification vendor, and they will be reviewing all of the reports, and they will be reviewing the testing structure, and they're making sure that they are doing what they are contracted to do, and that they will assist in helping us make sure that they play nice.
John and Shauna, I have a question. This is Barbara Smith Campbell. With respect to the healthy contract of $71 million, can you explain who's going to be funding that?
Yes,
yeah.
The first almost $20 million for the design, development, and implementation will be paid for directly from that section of the federal grant. There is a very small portion, 0.5%, that is being funded through the state general fund because the Medicaid and SSHIX functionality that the exchange will process through its system then demands a cost allocation, and the Medicaid and SSHIX funding has a very small general fund requirement. Then after that first year, there is that portion from January 1st, 2014 through December 31st, 2014 of another approximately around $30 million. I don't have that in front of me.
No, actually, I think that first year, I want to say it's closer to 12 to 15 million. I don't have the number right off the top of my head, but it's about that amount.
12 to 15 million will also be paid for from the grant. So the first half will make $30 million. So the first $30 million of the $71 million is coming from the federal grant, with small portions of general fund, Title 19 and Title 20 for the Medicaid and SSHIX portions thrown in.
This is John here. If I might add to that, we've been in discussion with Medicaid, welfare, and with Director Wilden at the Department of Health and Human Services. They are fully aware of this, as are the policymakers. We've included it in our contract summary that will go to the Board of Examiners. And so the Board of Examiners, if they haven't reviewed it already, they will, because it was on the previous Board of Examiners meeting. So they may have reviewed it at that time, but in any event, they will see that again when they go to approve it as well. So all of the policymakers and the agencies that general fund match affects are aware of that requirement.
Barbara, did that answer your question?
Yes, it did. And then the per member per month is going to pick up the difference on that?
On the back end, yes, that will be funded on the entire cost of that contract will go from a per member per month, so it is a variable cost, not a fixed cost at that point, and then that will be paid through the funding mechanisms that the board approves.
Okay. And at the end of the first 3-year term, is this contract going to be competitively bid out?
So the contract is currently 4 years and 184 days. That was based upon the last year. We're a little bit closer now. So it's through December 31st of 2016. At that point, the state can choose to use one of its options. There are 3 one-year options to extend that contract. At the point in which the state decides that it needs to rebid this RFP, you're looking, because this is a software as a solution, you're looking at a major change. The state will have to evaluate and decide at that time if it is in the state's best interest to do so or to contract for a further period.
Does the exchange own the software, or does the company? Are we buying the software, or are we leasing it?
We are leasing the software. I'm sorry, go ahead.
I was apropos with the previous question. It's sort of the barrier to entry for a new entity become very high because you have to first start from scratch all over again.
Yes, you are correct, sir. The modifications that 10% of the modifications that the Xerox Corporation will do to their software solution. The state will own that, and all of the data will be owned by the state, all of the membership data and such. But the actual, core software is owned and retained by Xerox.
And for the record, John Hager. So one thing people say, well, why do you own it if you can't really use it if you don't have the leased software? And the requirement is that the feds understand that this is a leased service that we're requesting. That what we own are these modifications, and the idea behind owning those modifications is that if another state comes up to purchase the Xerox product, that the modifications that they have to do due to the Affordable Care Act, since they've already been purchased with federal funding, that should be able to be reused at little or no additional cost. So that's the idea of owning those pieces of the modification.
Really, my question was for $71 million. Why don't we own it?
For the rest of John Hager. So, if you recall, back in January, we discussed the ideas of ground-up builds and lease builds. The decision was made to lease it because there was so significant risk in doing a ground-up build. And if we were doing a ground-up build, we would have to build all 100% of it. In this case, we only have to build or modify 10% of it. So the other part of that question is, why is it so expensive? And it is a very expensive product. We were very concerned about that when we first saw the bids, and we called around to various states. And when we got through the process of calling around to about 4 or 5 different states who had already done this, their costs were sometimes double or more of our expenses. So at this point, for the design, development, and implementation, we are cheaper than any other state by half. For the maintenance and operating expenses, we are right in the ballpark from many of the other states. So yes, it's very expensive. The problem with a product like this is, number one, it's fully subsidized by the feds. And number two, there are significant amount of requirements. There is significant risk to the vendor, and us too, but there's significant risk to the vendor because of the requirements in the service level agreement that they make sure that they meet these deadlines. And so because of that, the expenses are currently very high. The federal government is aware of that, and during our gate review process over the last couple of days with the Center for Consumer Information and Insurance Oversight, they were actually very pleased with our product. They were looking at our contract as an example for other states, and what they actually said was, we're looking at your contract as a low-cost example for other states. So while it is very expensive, it is cheaper than all the other products. The other part of that is, what happens when this contract expires. We have to go out to bid. If we choose another vendor, there will be some implementation expenses. However, I would expect that in 3 more years, if we were going to go out to 4 more years, if we were to go out to bid, or if it was 6 years if we extend the contract, that the technology will be in use throughout the state, and that it'll likely be a lot less expensive when we get to that point. Okay.
Do we have any other questions? Seeing none, does any one of the board members want to make a motion on this agenda item?
This is Ron Klein. I will move that we accept the bid from Xerox Services as to the recommendation of the committee.
This is Yvonne Lewis. I'll second the motion.
Is there any further discussion? I have do a roll call. Was there?
This was John Hager. I was going to ask if you wanted to take a roll call vote.
Yeah, I will take a roll call vote.
Okay.
All right, you can call the roll, John.
I apologize. Okay, Dr. Klein?
Aye.
Ms. Lewis?
Aye.
Ms. Kerr?
Aye.
Vice Chair Johnstone?
Aye.
Chair Campbell?
Aye.
Madam Chair?
Thank you. This item on the agenda is for possible action section is the discussion and possible ratification of the independent validation and verification standard. This is the complement to BOSS to make sure that they are being nice with all together. Am I saying that correctly, John?
Quite nicely in the sandbox.
Yes.
The sandbox. So, John, do you want to talk about this RFP 1956, or do you want Shauna to?
You have introduced it nicely. I'm going to turn it over to Shauna.
Thank you.
Okay, this is Shauna DeRuth. So the independent validation and verification, or verification and validation, because I guess they're switched around all the time. This one started a little bit earlier. This RFP was put on the street again by purchasing on January 23rd. Because the validation and verification was happening in conjunction with that search for the eligibility engine vendor, this went out ahead of time. In working with the CSIO and CMS federal partners, we spoke at that time that going through an RFP process obviously is an arduous process, and would it be a possibility that whoever won the RFP proposal for the ID&V for the eligibility engine, would it not make sense for that same vendor?
Oh, okay.
Okay. It sounds like we have a participant that's not on mute here.
Okay. So the feds approved the thought process that whoever won that original RFP to be the ID&V vendor for the eligibility engine, it made sense that they would also be the ID&V vendor for the BOSS project. So the RFP 1956 again was put out on January 23rd, and it was put in that RFP that it was the state's intention for subsequent contracts for those ID&V services to go to the same vendor. So the exchange did not have to go out again through that RFP process. The public consulting group was chosen as the vendor, and they will verify and validate system requirements, computing platforms, technical requirements, and security standards. They will do such thing as verify that the vendor, the BOSS vendor, delivers a solution that satisfies the exchange's requirements. They'll be doing all of these same items on the other side for the eligibility engine vendor as well, for Deloitte. They will verify that the architecture will meet the criteria for openness and industry standards for hardware, software, security, and communication protocols. They will verify that system integrity and recovery associated with the BOSS is apparent. They will verify that the processes and procedures to properly manage the development, testing, and training environments are performed according to the RFP, the for the RFP. They will review and make recommendations to the state. This is very important that they will be, kind of the project management office to overview over this entire process and make suggestions to the state. Work with the management on these projects so that we understand what both sides are doing. As Dr. Klein mentioned earlier, we're trying to take these different softwares and make them all work together, and CCD is going to be so important to that process. They will be the ones that consult with all of the stakeholders and make sure everyone is talking and getting a buy-in regarding the functionality that needs to be there to make this work correctly. So again, very similar to what I mentioned in the BOSS project, the responses to the RFP were scored based on conformance with the terms of the RFP, expertise and availability of the personnel. We reviewed references, we reviewed resumes. There was the cost evaluation, and then the financial stability of the company. On February 29th, there were 3 proposals received in response to the RFP, and there was a 5-person evaluation committee that also included the Nevada Enterprise Information Services Division, the Division of Healthcare Finance and Policy, Welfare and Supportive Services, and the Silver State Health Insurance team. So again, we had a good cross-membership team there with different expertise to bring to the table. We met on March 13th to consider each of the proposals. And of the 3 proposals, the evaluation committee selected Public Consulting Group unanimously as the highest scoring vendor. The effective date of this contract is planned to be upon a BOE approval, and the contract has been submitted to the Board of Examiners meeting for August 14th, and it will run through January 31st of 2014. The contract amount is not to exceed $1,518,880. This is based on a scheduled verification and validation cost of $1,380,800 with an additional $138,000 available for potential change orders. And with that, I would turn it over for questions.
Open it up for discussion, comments, or questions from board members.
This is Dr. Klein again. Do they have any experience in a similar role?
Absolutely. Public Consulting Group has performed these types of services. Again, they're similar to my discussion previously. There were requirements in the RFP that they get referrals from previous agencies. And again, PCG has worked in many different areas of the Nevada state government and worked and was able to provide good references.
And do they have this exact role of supervising the implementation?
Absolutely. Yes, they have, Dr. Flynn. They've had IBM specific experience. Yes.
Okay.
Any other questions from board members?
Madam Chair, this is Leslie Johnstone. Donna, what are their responsibilities for reporting problems, and what is the problem escalation process? I'm wondering exactly what their responsibility is for trying to resolve problems, or are they just to report problems to state representatives?
So one of their responsibilities is to consult with all of the stakeholders, bring us all together, both sides of these teams, and help us work together. If we saw on the boss side, if we saw that there was an issue, or if the welfare staff saw that there was an issue, and we could bring together with the IB&D contractor, and we could all work this out together. I think that we're kind of viewing them as a project management oversight of both sides of this. The RFP itself, the language in the RFP, has clear discussion of escalation processes when there are issues. And it goes into very specific detail about what would happen if there was a problem. And we would follow the RFP terms and conditions, and I'm sorry, Ms. Thompson, I didn't talk about anything at the time.
Okay, thank you.
Questions from board members? There being none, does any board member wish to make a motion?
Okay, I'll jump in and move that we accept this proposed law line for the record.
I'll second it. This is Leslie Johnstone.
Thank you. We have a motion and a second on the floor. Any further discussion? John, let's do a roll call vote again, please.
Did you do something? I can do it. Okay, so Dr. Klein?
Fine.
Ms. Lewis?
Aye.
Thank you. Ms. Kerr?
Aye.
Vice Chair Johnson?
Aye.
Chair Campbell?
Aye.
I think that's it.
A vote to ratify the selection of PCG for the IDD vendor. Before we go any further, I want to thank everyone. I'm going to open this up for public comment again, but I do want to thank everyone for accommodating this telephone conference today with our August meeting being reset, we wanted to make sure that we had the approval on these two vendors so that we can proceed to the Board of Examiners for approval there as well. So again, board members, thank you very much for accommodating us today. I'm going to open it up again for public comment, and anyone that wishes to speak, if you would press your name to the record and also spell it so we have it properly documented for our record. So, do we have anyone that wishes to say anything this afternoon?
Yes, Elise Monstetica for the record.
Yes, and if you could spell your name, please, for the record.
MOSS space Z as in Victor, E, T as in Thomas, I, C as in cat, A. Elise Monstetica, and Elise is spelled A-L-I-S-E.
Thank you.
Okay. This public comment relates to the call center. Can you expound on that, please? What are the expectations of the call center?
I don't think that we can respond. This is not a question and answer period, but let's have our AG help us through this process here.
Yes, this is Sarah Bradley, Deputy Attorney General. Normally, public comment is a time for the public to make comments. So if you have questions, you can certainly voice them, and at a next meeting, the board may try to answer those questions. But it's not normally a question and answer time. It's just a time for you to address the board on anything you think is relevant. So normally they don't engage in a discussion with any public comment.
Okay, thank you very much.
And if I might, if you do have questions, if you want to email them in or send them to the staff, then we can try and put them on an agenda to respond to you. Did you have any other comments that you wanted to leave?
No, I was just, since that was brought up about the first vendor being responsible for the call center and that the call center was going to be at Vegas, that much I gathered from the discussion. I was just wondering, what that entails. But thank you very much.
Is there anyone else that would like to participate in public comment?
Madam Chair, this is John Hager.
Yes, sir.
And I just wanted to point out that while some of the functions of the call center are in the RFP, some of that will be discussed during the Consumer Assistance Advisory Committees as well.
Any other public comment? There being none, then may I have a motion for adjournment?
This is Yvonne Lewis. I move that we adjourn.
Everybody's getting off?
Second on that motion.
Klein, second.
Thank you. And why don't we just do a voice approval? All those in favor?
Aye.
Aye. All right, we are adjourned. Thank you very much, everyone. I really appreciate your help done by telephone today. Have a nice evening, everyone.
Thank you so much.
You too.